Good morning. I'm Dr. R. Deuk, CEO and founder of the Deuk Spine Institute here in Florida. And today we're going to be doing some spine surgeries at the Deuk Spine Institute. It is now July 6, 2023. And this patient, the first one, she's got a lot going on with her lower back, but she has debilitating pain in her back. It radiates down her left leg. She had sacroiliac joint pain yesterday as well. We treated that already. But she has several discs in her lower back that are causing back pain and leg symptoms. Now, if you're looking at her MRI, you'll recognize that she has spondylolisthesis. And I get a lot of questions about spondylolisthesis in terms of, well, if you have spondylolisthesis, don't you need a fusion? And the answer is you do not need a fusion with spondylolisthesis, especially grade 1 or grade 2. Grade 1 and grade 2 spondylolisthesis, grade 1 in particular, is not that bad, and it can definitely be fixed, the pain and the symptoms from it, with the Deuk laser disc repair. Now, of note, we are not stabilizing this listhesis by fusing it, all right, like most surgeons will do. We're actually treating the source of pain and symptoms, which happens to be the disc, not the listhesis. There's a lot of misinformation about spondylolisthesis, a tremendous amount. And there's a lot of disagreement and arguing about spondylolisthesis in the lumbar spine. Half the surgeons believe you should fuse it. The other half of the surgeons believe you should not fuse it. And I used to be a believer of fusion because I saw that fusing with decompression would eliminate back pain and leg symptoms as long as you did a decompressive laminectomy along with the fusion, okay? So I was a big fuser and decompressor for lumbar spondylolisthesis until I started to do laser surgery, Deuk laser disc repair, at which time I realized, is she reliable? Is she okay? I can wait. Just give it a minute. Yeah. All right. So we're going to make our incision at this point because we're fixing two discs today. One of them is L4-S1 and the other one is L4-5. And you can see L4-5 has a slippage, okay? And it's a grade 2 slip, grade 2. Grade 2 means from 25% to 50%, so it's significant. And it's almost a grade 3. However, I believe with this procedure we're going to be able to eliminate her pain and not have to fuse her slip. We'll see if I'm right about that, but I've been able to do it in hundreds of patients over the years. So what I was saying is that I was a big believer in doing fusions for spondylolisthesis until I had patients who refused to be fused. Refused to be fused. I like that. I think we need an orbital fix on the x-ray. Okay? So they refused to be fused, and they said, do the laser endoscopic surgery that you do. So I did. And they said, if it doesn't work, we'll do a fusion. I thought it was a reasonable request, so I did it. And of course, it was met with success. The patient's symptoms went away, shot, and we didn't fuse them. We did the Deuk laser disc repair. So after doing it a few times and having success with the Deuk laser disc repair, I realized that fusion was not necessary with all of these listhesis cases and that we could fix people's symptoms without it. Give me an AP. And we've been able to do that for years. Let me know when she's responsive.
We're going to ask you some questions, okay? Can you open your eyes for me? Can you open your eyes?
All right.
Good. We're going to ask you some questions.
All right. So you can see with my second needle at 4-5, I'm too medial. I'm already at the lateral border of the pedicle of 5. I need to really move laterally. She's not going to be easy, by the way. You see on that x-ray she has scoliosis as well. She has listhesis, scoliosis, and I'm going to have to navigate around these deformities. The patient is awake, in case you're wondering. Shot. And she's awake because I do need her help in the beginning. Shot. All right, I'm a little bit higher than I want to be. So I'm going to have to try a different trajectory. Are you uncomfortable?
Are you having any pain? No?
All right, let me know if you do. So the reason I need my patients awake, two reasons. Number one, the nerve roots run right around here in this area. And if I get too close to a nerve root, then she'll let me know. She'll tell me she has pain shooting down her leg. And then I know I have to redirect and go to a different place. So I need her assistance for that. She is a physiological monitor for me. Wow, incredible, huh? How on the lateral view, that 4-5 needle looks appropriate, but on the AP view, it looks too low. All right, let's get another lateral view and see what's going on here. All right, so, I mean, I can see the top of the L5 quite clearly. I can see the bottom of L4. I can see the disc space. We're lined up beautifully. Jordan, what are your thoughts? Anything? The lateral view appears to be good, right? The only thing I can't see great is that pedicle of 4. Any way you can try to show me the pedicle of 4, but be prepared to come back to this same spot. So folks, what we're doing at this point is called navigation. And navigation in surgery means you're going from outside the human body usually to a place that you target within the human body. Now, in the case of this patient, we need to bring the table up just a smidgen, like half an inch. In the case, that's good. In the case of this patient, we're trying to navigate to 2 discs. Actually, that looks pretty good, but my gosh. I would bring the fluoro north, slide it north just a little bit. You may have to wag it back. What do you guys think? Is that the pedicle down there? That may be. I see the pedicle there, yes. Show me the bottom of the pedicle. The pedicle. Go to the right. No. You're in the right spot. There. See that black line? That looks like the bottom of the pedicle to me. All right? But there's another shadow further down there. And that could be actually the pedicle on the other side. But it doesn't make sense because we're able to see across the disc space quite nicely. And disc spaces don't lie. Well, let's see what we can do here. She's not an easy one, that's for sure, navigationally. Getting to where I need to be. Any pain? AP. So I'm slowly advancing my needle, spinal needle, thanks, to the target, which is, right now we're focused on the L4-5 disc. All right, it's not bad. Looks pretty good right there. Go back to a lateral view. So I'm advancing my needle, and this, to me, this is the hardest part of my surgery, is the navigation, creating a safe path from the outside world to the target being the annular tear. This is the hardest part of the surgery. Once I do this properly, then we're actually in good shape. Any pain? I can feel the herniation in the foramen.
She said no pain.
Wonderful. Thank you. You all right?
She's a little soft-spoken.
That's fine. I don't mind that as long as we're doing things right. Shot? That looks pretty good. So we're inside the disc. I'm inside the L4-5 disc. I've gone through the herniation. Now look at the bottom vertebrae, L5. I am in the middle of L5, maybe past it, but look at L4. I'm barely into the disc according to L4. That's because of the slippage. So L4 is grade 2 slip on L5. We knew about this going forward, coming here. She doesn't want fusion. I don't want to have to do a fusion, so we're trying this to see if it'll work, and I expect that it will. All right, let's go back to focus on 5-1. Let's line up 5-1 like we had it before. So we're doing 2 discs today, L4-5, L5-S1. And feel free to ask questions during our live stream. We're live streaming from Deuk Spine Institute onto YouTube, Facebook, LinkedIn, and Twitter. So you may be watching from any of those platforms. Right now we're adjusting our fluoro, which is what the tool we use in spine surgery to navigate. That looks pretty good. And we're just lining it up. If you want to do this kind of surgery, you must make sure you have, are you okay? Well, you must have AP. You must have reliable navigational information, okay? Imagine being in a ship on the ocean, a wooden ship without GPS and an iPhone. This is back 200, 300 years, 1,000 years, and you have the stars to navigate with, okay? You have to have reliable navigational information. If you don't, you're going to be lost at sea, and you're going to die, because there's no water out there. There's no food, and you're exposed to the elements. So the people that got on ships hundreds of years ago to explore, they did it because they had reliable maps, they had reliable navigational information. Well, with spine surgery, it's no different. If I don't have reliable information, then I cannot navigate to a spot that's 1 millimeter in the spine that I need to go to, okay? All right, so I feel like I'm at the back of 5-1, except I can't get in. It's so collapsed and degenerated. So that's a degenerative disc disease. We're not just fixing herniated disc, annular tear, back pain, listhesis, scoliosis problems. We're fixing a degenerative disc disease. All right, one more AP, and I think we're good. I may have to leave it at that. I'll place the guide wire later, and when she's asleep, I'll be able to put the dilator in. It's a little trick I developed at Deuk Spine for overcoming these types of issues when the disc is very degenerated, like L5-S1. All right, any questions from our audience?
No current questions, but we do have a couple comments. This first one comes from Edward on YouTube.
Mm-hmm.
And they said, I remember during my procedure, it took Dr. Deuk a very long time to get to the L5-S1. So happy he was persistent and didn't give up.
Edward, thanks for joining us. And thanks for commenting. Yes, I don't give up easy. I only give up when I know that the path forward will lead to an injury to the patient. So I will take every opportunity safely to try to fix a problem that I'm here to fix. I think I might have gotten some progress there. Yeah, we did. So I may not be 100%, and she's, oh yeah, there we go. Nice. So thank you for the comment. I would like to say another thing for those that are interested in this procedure. You have to be careful in patients with osteoporosis because you could actually go into the bone rather than the disc, and we don't want to go in the bone. All right, we're ready. If you put your needle in the bone, it becomes a completely different surgery. It becomes a procedure you don't want to do. We're here to fix a disc, which is a joint between bones. Osteoporosis is not a problem with this surgery as long as your technique is good. You can still fix the discs and not have problems. All right, I appreciate the comment, and thanks for joining us. Wait. So we know from this patient that she has 2 discs that are painful, L4-5, L5-S1. I think she has a third one at L3-4, but we talked about it. She wants to hold off on that for now. So we're just treating 2 discs. Are you awake? Are you comfortable?
She said yes.
All right. All right. Well, let's see. No pain? You see her back arch right there? How bad is that on a scale of 1 to 10?
9.
9 out of 10. Is that where you get your back pain? All right, so that's a 9 out of 10, folks. We just did what's called a discogram. A discogram is a test to see if a disc is painful. Now, I'm pretty sure that the L4-5 is painful based on my physical exam yesterday and based on my MRI. But doctors cannot be 100% sure if a disc is painful until they do a discogram. Now, notice she had 0 pain. She was laying there comfortably. And then I injected without telling her. What did she do? Her back tightened up. She stopped breathing for a second, like gasping. Why? Because it hurt like hell. That's her typical pain, so we call it concordant. It was 9 out of 10. Are you better now?
Yes. Better?
Sorry about that. We're going to put you to sleep in just a moment. Any pain right now? No? I don't know that I'm going to be able to get anything out because that disc is so scarred down, but I'll try. Oh, yeah. How bad is that on a scale of 1 to 10?
9.
9. All right. Is that where you typically get back pain? Is that where you get your back pain? I am so happy for you. Both those discs we're fixing today that pain is going to be gone when we're done. Congratulations. Go ahead and count from 1 to 100 out loud in Canadian. Nice and loud. She's counting in English, by the way. I don't know how all the French-speaking Canadians feel about that. But keep going. You're doing great. Of course, if she was from Montreal, she'd be counting in French. Or Quebec. Keep going. You're doing great. All right. We like to have a little bit of fun in the operating room. Otherwise, it gets dull. So, what have we discovered so far? The 2 of the discs I'm fixing today, number 4551, they are both painful. They're not painful right now without me stimulating them, but when I did the discogram, they were painful, which those are her typical discs that cause her pain. She told me her pain is in this area. She's had it for years. Now, most of you can see the listhesis, and it's bad. We're still going to fix her pain, and we're not going to do a single fusion. No metal, no fusion. We're doing what's called the Deuk laser disc repair, for those of you who don't know. So, Henry, let's show our audience why do discs actually hurt. It's not the listhesis. It's not bone on bone. It's not scoliosis like we all used to think. It is actually an annular tear in the back of the disc. We're doing the DLDR, Deuk laser disc repair, pioneered at Deuk Spine Institute. Peer-reviewed, published in the medical literature. Let's go ahead and run our educational video showing why do discs actually hurt.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
I was just talking to a visiting anesthesiologist about the fusions we've done here at Deuk Spine. You can go on YouTube right now and pull up hundreds and hundreds of fusions I've done here. 1 level, 2 level, 3 level, 4 level, 5 level. And I've been doing the 5 level open from here to here, sending them home, patients home in 2 hours, consistently. And not only that, but they dance before they leave. We call them dancing fusions. Every single one of them, I videoed them dancing. All right? They're on narcotic painkillers, right? We put them on Dilaudid. We have some Robaxin. But they're up, walking, and dancing 2 hours after surgery, going home with a drain. We did it for years. And now we're doing everything through a 7mm incision. It's completely revolutionized spine surgery. There's no metal, there's no fusion, there's no cages here. And we're treating a grade 2 listhesis at 4-5. And the reason why we can do this is simple. Because the listhesis is not the problem. Lots of people have listhesis, and they have no symptoms at all. So how do you explain that? If listhesis is the problem, why is it not all leading to pain and suffering? The vast majority of patients with listhesis don't have symptoms. At least 80%, 90%. Only 10% of listhesis has symptoms. But you could say the same thing about a herniated disc and an annular tear. Lots of people have them, but they don't have symptoms. So in the end, it turns out that just because you have a structural abnormality doesn't mean you have symptoms. Because symptoms are not structural, they're physiological. They come from a physiological basis. And that physiological basis is inflammation. Inflammation is the source of pain. All right, we are entering the L4-5 disc right now with a dilator. The dilator is passing along the guide wire. You can see it. The guide wire is in the L4-5 disc, and it's guiding my dilator. Okay? Now, I wouldn't be doing this without a guide wire. The guide wire is so important. You cannot do this safely without it. I've seen doctors try to do this without a guide wire, and they cause all kinds of complications. Now, before we go there, folks, for those of you who've never seen the surgery, the entire surgery is going to be done through this tube. People always ask me, is this surgery FDA approved? It is. Everything is FDA approved. This is true endoscopic spine surgery you're watching. Now, other surgeons will tell you they do endoscopic spine surgery, but they don't. They do what they think is endoscopic. Shot. All right, so the tube is going down. Now we're inside the L4-5 disc. And the tube is in really good position. I've got something on my face mask tickling my nose again. These face masks, I tell you, the quality control. It's right here. It's like a fuzz just inside. If you can reach in there and try to pinch it out.
Is it up here?
Yeah, I would go, right where your fingertip is.
Try that.
That's better. Thank you. All right, so, folks, if you have questions, type them up. We'll read them out loud, and I'll answer them for you. But Henry, why don't you show our audience what does the Deuk laser disc repair actually do? Why does it work? What are we targeting? What are we treating? Just so you guys understand, the Deuk laser disc repair is a procedure that literally targets the source of pain like a Navy SEAL team would target a house in Pakistan and go after the #1 terrorist in the world like Osama bin Laden, which we did years ago. All right? There's no collateral damage. There's no civilians killed. There's no destruction of property. It's literally one source, one thing, one little thing, and that's what we're getting. We're going after it. It's called the annular tear, and that was discovered here at Deuk Spine Institute. We discovered that the annular tear was a source of back pain and neck pain. That was discovered 16 years ago, back in 2007, when I started treating them. And, you know, fortunately, a lot of people have learned about our technique. Have you done the educational video yet?
Not yet.
All right, let's go ahead and start it so our audience can see what we're doing here with the laser.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. Yeah. Well, we were just talking, I was talking to my guest, Dr. Young here, about a different Dr. Young in Phoenix, who taught me a lot about endoscopic spine surgery. My mentor, my greatest mentor, I would like to say, is Dr. Anthony Young out of Phoenix. He worked at the Desert Institute for Spinal Care, aka DISC. And he founded it, and he's a pioneer in this type of surgery you're watching right now, in the lower back. He never did cervical, he never did thoracic, he was only lumbar. And he did a lot of lumbar. Back in the 90s, 2000s, when I met him in 2006, and he started training me along with a bunch of other spine surgeons. He was training a small group. There was about 10 of us. And of all those 10, I think I have probably taken his teachings the furthest in the world in terms of number of surgeries and widespread use of his knowledge and his techniques. And one of his techniques was called the inside out. We were just talking about it, where we start the surgery inside the disc, not in the foramen. There's another group of endoscopic spine surgeons that start inside the neural foramen and then work their way down to the disc. I do not agree with that technique. I would never do it. All right, here's the annular tear right here and the herniation, and this is the source of the patient's back pain, not their listhesis, not their scoliosis, not the bone on bone, not the lack of nucleus like everyone thinks. And again, there's so much misinformation out there, unfortunately, that people are becoming victims of misinformation. That's why we do our broadcast, to teach people the truth. And we show you what we're doing, because we're not just talking about it, we're doing it. We do it every week. And our results speak for themselves. All those patient testimonials we have, those are real patients with real surgery. All right, let's take some questions from our audience.
All right. First one is a comment, and this comes from Rafa on YouTube.
Hello, Rafa on YouTube. Thanks for making a comment.
They said, "Good morning. I just had a discogram done. And was told I have two bad discs at L2 to L3 degeneration discs. I do get a lot of pain in my back. I have an upcoming visit with the neurosurgeon this coming Monday. I feel sometimes my back feels stuck and hear nap in my back."
Yeah. Well, thanks for sharing your experience, Rafa. You're correct. If they did a discogram and they did it properly and you had pain from two discs, then those two discs are the source of your pain and you should get them fixed. The only difference is that your neurosurgeon does not know how to do this surgery. And you really should come to Florida to get it done. Your surgeon will probably offer you, if they do the right thing, they'll offer you an artificial disc or they'll offer you a fusion. Because artificial disc is terrible surgery. I would not choose it as my first choice. But if you had no other treatment in the world but an artificial disc, that could be very helpful for you. Now, a fusion, if it's done properly, would be a better procedure, in my opinion. And that's if they do it properly, okay? But the best surgery in the world is this, because there's no fusion, no metal, no plastic. We're not putting any cadaver bone in your spine. This is a natural repair to your disc. And it was discovered at Deuk Spine Institute, and it's only performed at Deuk Spine Institute here in Florida. It's worth the trip. People travel from all over the world, Rafa, to come here to have our surgeries, okay? This is the tear. This is where all the pain comes from. You can see there's herniated disc in there. Great comment, and I appreciate you sharing with us. All right. Rafa, what I would advise is use our link. We're going to put it in the dialog box here that you can submit your MRI to Deuk Spine. We'll do a free virtual visit for you. We'll tell you what we would recommend done, and we'll see if you're a candidate for this laser surgery. This is the safest surgery in the world for a disc problem. There's no bleeding. There's no scar tissue. The only trauma is to your skin where we make the incision. And we then enter through your disc right where the tear is, right where the herniation is. So we're not damaging your disc. We're going through the damaged part of your disc already. We're not creating any new damage. We're going right where the pain and the damage is. And of course, your muscles, we're not damaging them. We're passing through them. A lot of people ask me, doesn't the dilator and the hammer, doesn't that do damage to your muscles? No, because muscles are called muscle fibers. Muscle fibers are just that. They're like strands of tissue, like stringy tissue. Just like a shirt that you're wearing. It has fibers. And if you take a pin and you push the tip of the pin, the safety pin, through the fibers of your shirt, is it going to tear a hole in your shirt? No. It's going to spread the fibers. Microscopically, if you look carefully, you can actually see the tip of the pin will push the fibers apart. It'll enter your shirt, and then when you take the pin out later, there's no damage to your shirt. There's no hole. The fibers come back together. Now, your body is the same way. You've got muscle fibers. You've got collagen fibers. You have all kinds of fibrous tissue under your skin. The only thing that we can't pass through is your skin. We have to make a cut. And that's the only damage in your entire body. So with fusion surgeries or laminectomies or other types of invasive back surgery, you're going to be taking painkillers for months, like narcotic painkillers, after your surgery. The reason you're taking those painkillers is because you're in pain. The reason you're in pain after open back surgery is because the surgery has destroyed your body underneath the skin. You just can't see it. You have muscle damage, you have bleeding, you have hemorrhaging, which is bleeding, you have trauma to all kinds of tissues. And that's why they hurt so bad. But with Deuk laser disc repair, there is no trauma and there is no need for painkillers after surgery. Our patients will go home from this surgery tonight and take one Tylenol, if that, and then that's it. There's no more pain. They come in the next day and they're not on any painkillers because we don't prescribe them, because they don't need them. We used to prescribe painkillers, but people just weren't taking them. So I stopped prescribing them a long time ago. And our surgery doesn't require post-operative painkillers. Now, of course, you're going to get some painkillers during the surgery because this hurts. Having a metal pipe in your back is always going to hurt. There's nobody that can do this without anesthesia. However, after surgery, there's no pain, so people don't take painkillers home with them. Piece of herniation, it just doesn't want to leave. All right, there we go. Almost done. So this disc is the worst. This is L4-5, right, Luis?
Yes, sir.
It is the hardest that you can do in this surgery, okay? Because it's a slippage of 50% bone on bone. It makes it very hard to get to, technically, but I already did that earlier when the patient was awake. And she's got scoliosis and a collapsed disc. Most surgeons that do endoscopic, they don't have the skill or experience to do what you're seeing done now. It's only because I've done thousands of these surgeries with great equipment. I have the best equipment, and I have the best team. My team here, my anesthesiologists, my nurses, my technicians, Luis, my secret weapon, right? Because of this team, I can do this. One of the reasons I left the hospital was because the hospital kept giving me staff that weren't trained, giving me equipment that was old and not working properly. And I would not operate at the hospital under those circumstances. Because what happens when your staff are not trained properly, your anesthesiologist doesn't do a good job, the patients get complications. Huh? Are you guys, how are we doing on irrigation? Good. All right, good. All right, fine, thanks. That's the first bag? 3 liters? Thanks. So most surgeons, if you talk to them, the ones that leave the hospitals, they leave because they're so sick and tired of the hospitals not providing them with the equipment, the staff, the medications, the supplies that they need in order to do the best care for their patient. So you have a very conflicted life as a surgeon in a hospital. All right, you need the hospital to do your surgeries and make a living, but you hate the hospital because they don't give you what you need for the patient, to give the patient the best experience. Okay? So when I started to have complications at the hospital, like pneumonia, because the patient got too much fluid during surgery from the nurse anesthetist, that's when I decided I was either going to quit medicine or I was going to have my own surgery center where I can hire the right people to do anesthesia. So what do you think I did? I invested, I borrowed money, millions and millions of dollars, and I founded Deuk Spine Surgery Center here, Surgery Center Viera. And I never have looked back as it was a bad decision. It was the best, one of the best decisions of my career. Anyway, we'll take some more questions. I'm sure we got a pile of them.
Indeed we do. This next 2 come from Marcus on YouTube.
3 minutes on this disc. Yes, Marcus on YouTube. Thank you for writing in.
They asked, I think it's 2 of the same question, but one of them is, when you do the discogram to check if a disc is causing pain, how about when the pain is more in the glutes and legs because of the bad disc influencing nerve roots?
Great question, Marcus. Great question. So Marcus is asking a very intuitive, insightful question. When you do a discogram, you test for back pain. But what about patients that have leg symptoms? Does the discogram help you with that? The answer is no, it does not. The discogram is not good for eliciting leg symptoms. It's only good for eliciting discogenic back pain coming from the disc. So you got to figure the leg symptoms out differently. A discogram will not be helpful. You got to look at the MRI, you got to look at the EMG, nerve conduction study. You got to do a good exam on the patient. You got to understand the distribution dermatologically and myotomologically, which is your dermatomes and myotomes. Just about done here. Keep coming with the questions.
This next one comes from Simon on YouTube.
Hello, Sidon. I like that name.
And they asked, what happens if the patient can't stay still due to spasm? Is there something that can be done to stop the legs from spazzing during the surgery? Thank you.
Yes, Sidon, absolutely. When you're asleep, your legs don't move. I would bet you if you have somebody in your room with you when you're sleeping, when you're in a deep sleep, I bet you your legs don't move. They probably move when you're awake. So we put our patients deep enough asleep the legs don't spasm. But that said, if they do, it's okay. Because the legs are down lower and they don't interfere with me. But I know what you're talking about. We have lots of patients with leg spasms. They don't spasm during the surgery as long as they're deep asleep, which we put them deep asleep with the anesthesia. Great question.
These next three come from Juan on YouTube.
Hi, Juan.
And they, first question is, hello, doctor. Some questions. First, based on your comment, you can fix the disc bulge or herniation and fix the pain avoiding laminectomy?
Yes, we can. That's correct, Juan. Disc pain, laminectomy will never fix disc pain, ever. Laminectomy's purpose is to fix weakness, numbness, and tingling in the legs. Only the legs. Laminectomy is not a surgery for disc pain. If you've been told that by your surgeon, they're not being honest with you. You have to go back to them and ask them, and look in their face, and ask them, will this laminectomy cure my back pain? They will tell you, no, it won't, if they're honest. Laminectomies are only for leg symptoms, like weakness in your legs, numbness in your legs, or tingling, okay? What fixes back pain from a disc is either this surgery or fusion of the disc. That's why a lot of surgeons will tell patients, get a laminectomy first, and then if you're still having problems, we'll do a fusion. They know you're going to have problems. They know you're coming back for another surgery. That's how they make their money, is by doing multiple surgeries. All right, I think that's the last of our disc here, and we'll be done with this one. Just underneath the nerve root right now. This is going to be at 4-5. This will be the L4 nerve root. Just the last bit of herniation here is what I'm trying to get out. Keep the questions coming. I'm happy to answer them for you guys.
Copy that. Next question from Juan. They asked, MRI shows stenosis but does not state if it is coming from the disc, bulge, or bone growth. I have degenerative disc with mild to moderate foraminal and canal stenosis.
Yeah.
Pain is only on the back but persists. How does damage to nerves or canal nerves is avoided with the laser?
So great question. First of all, your stenosis is coming from primarily a disc herniation. Okay, it always is. Lateral recess and foraminal stenosis in the spine are 99.9% of the time from the disc herniation. So this surgery, that's what it fixes. Now you can also have some stenosis from ligamentum hypertrophy and from the facet joint coming forward into the foramen and lateral recess, okay? But this surgery, transforaminal endoscopic surgery, can fix all of those because you can see them all. We are literally in the foramen looking directly at the nerve root. So we can see exactly what is bothering it. Yep, switch irrigation is a great idea. So this surgery you're seeing, transforaminal endoscopic Deuk laser disc repair, is literally the very best technique for treating stenosis in the lumbar spine, cervical spine. And we do it without open back surgery. We do it with, you can see, a 7mm incision. Next question.
No current questions.
All right, let's get a quick x-ray. So far we need to get that tube out of there. We have finished treating L4-5. And is that really the picture? Wow, that's incredible. Guys, look at the slippage. It's moved back. Look at the slippage of L4-5. It was grade 2 going on 3, and now we've moved back 5 or 6 millimeters. All right, pretty cool.
Cosmetic spine surgery.
All right, the reason that's happened is I think because we got rid of the herniation in the foramen, so the spine is able to come back again and take over that space.
We have a comment from Canes25 on
Sure.
YouTube.
I'll take Kane's 25 shot.
They said, Luis takes a beating sometimes, but he just keeps producing. Go, Luis.
Luis takes a beating, but he keeps on ticking. I love it. Come on, I wasn't giving Luis a hard time at all today. Was I? Do I need to? Should I give him a hard time? Luis, should I give you a hard time? Right? You're right. You obviously watch a lot of our surgeries, and you know that sometimes Luis is my punching bag. But he's amazing. And, you know, I even yell at myself at times. At myself. If I screw up something, I will literally beat myself up. Not physically, but mentally, for making a stupid mistake. That's what my father taught me as a child. You have to take personal responsibility for your mistakes. Don't blame others. Figure out what you did wrong and fix it so the next time you do it right. That's something I've lived by my entire life. Shot. Now, when I get upset with Luis, it's because he's done something he's not supposed to do. And, you know, I treat him like a family member. Wonder if I should. Maybe you can get it out? So I basically have pinched the guide wire. Thank you. And speaking of pinches, Luis has gotten me out of many pinches. She's a little bit light. All right. So the problem with the patient being a little light, folks, is that if she's light, she's tightening up her muscles, she's clamping down on my tube. And it's going to make it hard for me to do the surgery, especially on a disc that's already collapsed. Thanks. So far, questions have been good. So far, the surgery is going well. Patient is stable, doing great. We're going to be done in about 15 minutes. So if there's other questions, I'll take them. If not, I'll just keep blabbering.
No current questions, but we do have a comment from Juan saying, I do have facet
Arthropathy.
arthropathy too. I will submit my MRI. Thank you, Dr. Deuk.
Yeah, you're welcome, Juan. We can fix your facet arthropathy. What do you think? With the Deuk plasma rhizotomy. We've done the Deuk plasma rhizotomy now for 1 year, over a year almost. It's proprietary. We do it only here. We've expanded the indications to include the SI joints and the knees. We're eventually going to be doing shoulders and hips as well. And really, when the if you're faced with a knee pain and you have to have surgery on your knee, you can get the Deuk plasma rhizotomy done to get rid of your knee pain and maintain your function without metal or fusion or hospitalization. The recovery is 15 minutes, and most of our people go back to work the next day. If you go to our YouTube channel, you can actually see the Deuk plasma rhizotomy for knees, which Henry, who's our my broadcaster here, Henry has created that channel. It's new. It's at the top of our playlists at Deuk Spine YouTube channel. You can see how you can get rid of knee pain. If you have chronic knee pain, you've been told you need a knee replacement, you don't. We can fix it with a simple outpatient procedure with 3 little cuts that are 3 millimeters each with the Deuk plasma rhizotomy for knees. All right, so far this patient's surgery is going well. So who's watched season 3 of The Witcher so far? All of it? A lot of it? Enough?
I watched the first and second season, I'm on the third, and I'm on the second episode of the third season.
All right, what do you think so far? Don't give anything away, but
It just gets interesting all the time.
yeah?
Yeah, it's really, really good.
So I watched the first of season 3, okay? And I personally think it's a little slow. Not enough action.
I can agree with you on that. Yeah.
Huh?
A little bit, yeah.
Right?
Because I like more of like fast, you know.
Yeah, fighting monsters, solving problems, the usual stuff.
There's a lot of
Lasers off? What happened there? What happened with the laser? Oh, okay. No problem. All right, but it wasn't that it came on and then turned off.
no.
All right. I was worried it was malfunctioning, but it's fine.
But yeah, you're right. I think it should be more like fighting ghosts and things.
Yeah, so far. I mean, maybe it's going to get better, but I'm also thinking, you know, Henry Cavill has decided to leave The Witcher. So, you know, he was talking about the storyline and plot and, you know, all that scripting as being the reason. So I'm just wondering how bad season 3 is actually going to be.
The reason the why he actually left is because he was originally going to go back to Superman,
Uh-huh.
and then they decided not to go with him again. So by the time he did that, they already replaced him on The Witcher already.
Oh, I don't think so.
No, I mean, there could be more. I don't know.
Oh, no, there's more. I heard that he's not happy with the way that it's being, like, directed.
Yeah.
I could be wrong, but I don't know. Who knows,
I
right?
feel like in the beginning it's going to be slow because of the girl, but I think as the episodes continue, I think it's going to get faster.
Yeah, I hope so.
But so far it's good.
It is good, yeah.
Yeah.
You know, it was the #1 watched show
Yeah.
in 2021. At the end of 2021. It literally launched middle of December,
Yeah.
season 2, I think, and in 2 weeks, people binge watched the entire season to make it #1 watched TV show in Netflix that year.
I watched the whole first season in 2 days.
Yeah. How about you, Luis? You like The Witcher?
I like it.
Yeah, it's good, huh?
I started season 3 and they focus more on the little girl than, you know, I said,
Apparently she's like important, but
yeah,
I don't mind that, but it's just kind of slow. You know, like all the training going on.
correct.
It's fine, but let's get some action.
The one that I got into is Secret Invasion.
Secret what?
Invasion?
It's called Secret Invasion?
Yeah, it's a Marvel series.
Yeah?
Yeah. With
That's on Netflix?
It's on Disney Plus.
Disney. Secret Invasion. All right. All right, Henry, any questions from our audience?
Yes, we have a question from Nick on Facebook.
All right. Hi, Nick. Welcome.
They ask, hello to the best team. Question,
Oh, thanks.
is the fusion like teeth braces? I mean, when the fusion does its job, you can take it out of your body?
Yeah, you are correct. The purpose of the fusion, well, so let me explain it. We have to understand there's two things happening. There's the instrumentation, we call it the instrumentation. That's like putting the metal in, screws, rods, okay? Now the surgery is called a fusion, but fusion is actually a process whereby bones, did the settings change?
Feel slow.
Feels slower. Can you check it?
Yeah, I'm checking when you stop.
So instrumentation, good? Yeah. Instrumentation is when you put the screws and rods in. Surgeons call it a fusion, but they're not actually fusing you, okay? The fusion is what your body does 6 months later as you grow bone. And you grow bone from one vertebrae to the other, so they quote unquote fuse together. They grow together, so there's no longer a joint that moves. There's no more movement between those bones. So that's what a fusion is, okay? Fusion is when the bones grow together. If you break your wrist or break your forearm and there's two pieces of bone where there used to be one, if the surgeon puts you in a cast and those bones grow back together, that's called a fusion. Your bones are fusing. So fusions happen all the time with broken bones when they mend. That's called a fusion, all right? But the process of fusion takes 6 to 8 weeks in a healthy individual. and could be longer in somebody with bad bone, like osteoporosis or osteopenia. So to answer your question, during the fusion surgery, the surgeon's not fusing, he's putting screws and rods, okay, like the braces. And you're right, 6 months later, if your bones fuse together, you do not need the screws and rods. The problem is that we're done. The problem is with this, we still have the DPR. The problem is that let's see if we can see. Let's see if we can see the nerve. Root, nope. It's encased in fat. So the nerve root's right in there. You can see some veins, some fat, but we're not going to get a good view of the actual nerve root itself. All right, scope off, good job. We're done with the 2-disc laser surgery. We're going to move on to the facet joint treatment. But getting back to your point, yes, you can go in and remove the hardware, okay?
No, this one is fine.
And the patient should be fine. However, the surgery to remove the hardware has a lot of risk. So why would you want to go through that surgery with all the risk to take out hardware that's not doing anything bad? Now, sometimes the hardware can do bad things. For example, in really skinny people, guide wire. Is it another one? Never mind. No, we're good. So sometimes, like in some patients, I've got one patient I'm thinking of that he has no fat in his body at all. And he had chemotherapy for cancer. And now he's lost so much weight that the screws are literally pushing against his skin from the inside, and they're about to poke out. So I recommended that we get his screws and rods out, and we're waiting for that to be approved. So we may be doing a hardware removal next week on a patient who has to have the screws and rods taken out, okay? But not because he's fused, because they're about to poke out through his skin. So that's the only reason, whether it's infected hardware or the patient is allergic to the metal, which is very rare, but I've seen it happen. So if you're allergic to the metal, if the metal is infected, or if it's going to poke out through the skin, that's your reasons for taking it out. There's no other reason to take hardware out. Surgeons will often tell patients to get hardware taken out because they actually make a lot of money doing that. But the only reason to do it is it benefits the surgeon and the surgeon alone. It doesn't benefit the patient. Talk to patients that have their hardware out, they'll tell you, I had my hardware out, I still have the same pain. Now sometimes surgeons will trick people and they'll tell them, yeah, we're going to get your hardware out and we'll look around. They have the intention of actually doing another fusion. And they know they're going to do another fusion. Shot? Perfect placement. Look at that. No fluoro. Nailed it. Okay. Tell Dr. Patel he can go home. I'm kidding. All right. So we're going to do our Deuk plasma rhizotomy. You can see the target is the transverse process, which Jordan is outlining. And right where it connects on the top border with the superior facet and the pedicle, right? So basically, we're going to target that spot. There's a little nerve there that all it does is it brings pain from the arthritic joint up to the brain. And doctors have known about this for a long time, and they've been doing procedures called RFA, radio frequency ablation. You may have heard of it. The problem is that it doesn't work. And when it does work, the nerve always grows back. And they'll tell you, hey, you need to come back again and get this done over and over again. Okay? So we at Deuk Spine said, we shouldn't do that. Let's fix it permanently. And that's why we developed this technique. This is called the Deuk plasma rhizotomy. And the whole purpose of this procedure is to treat facet joint pain in patients with facet joint pain. the target again is the same as a radio frequency ablation. It's that same area, and then instead of just sitting there like an RFA probe does, we actually can move our probe around and make sure that we get that pain nerve and burn the hell out of it. Shot? I think I'm a little, all right, it's not bad. One down. Now, Dr. Patel already did the, He did the other one. He did the S1.
Yeah.
So I'm just going to do one more here. And we'll be done. So our patient is almost done with her surgery. Just 5 more minutes. Way too lateral. Your drape is coming down, but that's fine.
Yeah. I just removed.
Oh.
Yeah.
Shot. Shot. Too low. That's actually good for the S1. That's about right. I feel the bone. You always got to feel bone when you're doing this. You want to make sure you're in the right spot. Shot.
Thank you.
So we're using X-ray to make sure we're in the right spot. So you use X-ray for 2 things in spine. Number 1, we call it localization, meaning picking the right spot. So right where the tip is right now is literally the very perfect spot for a rhizotomy. Good job, everyone. Congratulations. I'm going to come and answer questions. I'm going to call the EBL 10 cc's. You're going to do a staple, and you'll put the steri strips. All right. So we're done, and I'm going to come answer questions to you guys directly. So go ahead and type them up. Huh? Good size? Herniations? Good. Oh, no, let him hang with you for a little bit. We'll have plenty of time. I know he doesn't want to spend his whole vacation here, but. Oh, yeah? Were you planning on heading out in a few minutes or what? Let me go and do the next patient's timeout. And then you're welcome to bring him to the conference room when you're done. And then I can talk to him for a little bit. All right, thanks everybody. Great job. Oh, yeah. So EBL 10. A bit of an more than normal. You got the fluorodose and all that? Are you going to put that? No, it's all right. So we did a DLDR left, L4-5, 5-S1, and a DPR left. Yeah. Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago and here you are ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort, and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research, and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are, pain-free for the first time in many years.
Many years. years.
Congratulations.
Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, "Why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento?" And I said, "Well, because I was referred to Dr. Deuk and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions, and that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All
life.
right, thank you.
I'm Dr. Ari Deuk at the Deuk Spine Institute, here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No,
Gone.
I feel my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's going to work. That's when I started looking for other options, and I had a lot of time on my hands. I did a lot of research, and I found Dr. Deuk here, and I started watching his videos and testimonials. Made up my mind right there. It was without a doubt that was my choice right there. I submitted my MRIs, and within 2 days I did my virtual consultation with you, and 10 days later I'm here. And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
Yes, I'm done now. It's just I'm back to recovery.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's two surgeries that work, fusion and the Deuk laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain, pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually one or two Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-S1 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Deuk any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. I'm Dr. Deuk Majin, and you are just in the operating room with me. We've completed our surgery on this Canadian patient who's traveled here for back pain and left leg pain from a pinched nerve. Now, she has a lot going on in the spine. It could get confusing for most people. Fortunately, it's not confusing for us at Deuk Spine. So let's talk about all the things she has going on. She has disc injuries. These injuries are tears in the back of the disc. This is the front. This is the back. She has a tear in the wall, and the jelly in the center, called the nucleus pulposus, is pushed through the tear, preventing the tear from closing. That creates inflammation and pain. That is the problem. It also was big enough of a herniation. It was hitting her nerve that was coming out of the neuroforamen on the left side here, and it was pinching the nerve. Now, on top of that, her spine was twisted to the side, scoliosis, and if you look to the side profile, this bone was slipping on this bone. Actually, L4 was slipping on L5. So normally the vertebrae are lined up nicely. She had a 50% slip, all right? Almost a grade 3, we call it, right at the border. When I was done with her laser surgery, she had moved back from a 50% to a 40% slip. So there's actually an improvement in her listhesis with the surgery. I don't tell people they're gonna get their listhesis improved because I don't expect it. What I expect is the pain to be gone, and that's what we're going to do for her. So her surgery went well, despite the fact that we didn't fix her listhesis, we didn't fix her scoliosis, we did not fix her degenerative disc disease. All of those things are still there. Okay, we call that deformity because the spine is out of alignment, out of position, so it's deformed. We did not fix her deformity, folks. All these spine surgeons are out there telling you have scoliosis, you need surgery, fusion. You have listhesis, you need fusion. You have degenerative disc disease, you need fusion. The problem is that all those are not true. They're lies. Are they lying to you intentionally? I don't think they are. I think they're lying to you because they don't understand what they're doing. But you need to understand because you're the one who's going to be the recipient of those screws and rods, and you don't need them. We're able to fix back pain and neck pain and thoracic pain without screws and rods or cages or artificial discs. You don't need any of that unnatural junk in your body. Now, the companies that make these things, they're billion-dollar companies, and they keep promoting it, right? Kind of like the sugar industry wants you to eat sugar. They want you to eat sugar because that's where they make their money. Sugar is not good for you, right? The high fructose corn syrup manufacturers, they want you eating high fructose corn syrup because that's where they make their money. The companies that make sugar and high fructose corn syrup products They call the supermarket guy and say, hey, supermarket man, we want you to stock our deadly dangerous products on your shelf so that consumers will see them and buy them. And really, we want you to get rid of all the other stuff so that they have to buy our stuff. That's what's happening today. Except the stores that are selling this stuff are now hospitals, and surgeons are the shopkeepers selling it to you. We're trying to tell you, scratch that model because it's harmful to people. What you need is what you saw done today at Deuk Spine Institute. Minimally invasive, tiny little cut, repair your spine, don't fuse, don't put an artificial disc. That's what we're doing at Deuk Spine. We're now doing it for sacroiliac joints. So if you have sacroiliac joint pain, you don't need a fusion anymore. We can do it with plasma rhizotomy, called the Deuk plasma rhizotomy. We're going to have some testimonials up probably by next week where you can see some of the patients that had it done. This patient had it done. You can see some little marks on her tailbone. She had it done yesterday. Her sacroiliac joint pain is gone. Okay. Finally, we're also doing Deuk plasma rhizotomy for facet pain as well as knee pain. And we've had now almost 10 patients that had the DPR done for their knee, and their knee pain's gone. So it is the future of spine and joint surgery. And it all started here at Deuk Spine Institute. The rest of the world will take 50 years to catch up. All right? So we're not interested in training surgeons, changing hospitals and surgeons, because they don't listen. We're interested in educating you, the consumer, the patient, the person who has to suffer through treatments. Anyway, let's get to our first question.
First, we actually a couple of just comments and one question. This first comment comes from Canes25. I'll read before that, actually. He has a couple. You guys are for sure one big family. I Am Family pushes one another to the greatest potential. It's more exciting to watch than any other TV show.
Oh, Canes25, thank you. So since you're talking about TV shows, and since you're one of our avid viewers,
yeah,
I want you all to know, I'm going to make an official announcement. I have now had several high-level meetings with a Netflix documentary producer and distributor and director, and we are in final stages of budgeting and putting together a movie. The first movie, it will be 60 minutes. It'll be a docudrama. It will involve real actors. I will probably not be one of them because I'm not very photogenic, or my voice sucks too. But that said, our ideas are what matters, and this program is going to expose the spine scams happening worldwide, promulgated by the companies that manufacture these devices. It's going to be the first of a series, which I think eventually, if there's enough interest and enough viewers, we need 2 million views, Netflix will pick it up and pay for it, and they will then do further series production. So I don't have to pay for it. That said, in the end, I really envision as the final move, the checkmate move, is a reality TV show where we have camera crews in our clinic every day recording real life experiences in the operating room, in the clinic, and people agreeing to allow themselves to be videoed for it. And doing a reality TV show, because I think this is big enough, the word needs to get out. So anyway, that's a taste of the future. There's a lot of other things I'm working on. And people think I just do surgery. I don't. I create ideas. I run this company. I manage all these people. When the problems get so big, I have to solve them. I have great people helping me, but in the end, I have that responsibility as the CEO and founder of the center. And I also am working on our new website that's trying to work out of Sweden, and new AI that we're developing to help diagnose and treat patients. So there's a lot of initiatives here at Deuk Spine, and I appreciate all your support and your encouraging words. Yes? We're live streaming. How can I help you?
There's somebody up front for you about one of your patients.
Okay. Why don't you talk to or Dr. Patel. All right, so appreciate the comment.
And we have a question. This comes from Dan Mosley on YouTube. And they asked, what about pain in buttocks when sitting? Pain goes down the leg. I have a couple pics on my phone of an MRI and MRI report. Doctor told me bone spurs between L4 and L5 have had lesi, lasted about 2 weeks. Back to can't sit down and drive for more than 30 minutes.
Okay, thanks for sharing. Great question. I get these a lot. So basically you're having buttock pain going in your leg. You've had a lumbar epidural steroid injection which helped for a couple of weeks. So your story is very common. I'm going to tell you this. The MRI may have shown stuff like bone spurs, but here's the deal. Right now, you don't have a diagnosis, okay? And that's the biggest problem. You need a diagnosis. And why am I saying that? You may have sciatica, but why? The most common cause of sciatica is a herniated disc irritating a nerve root in your back. Maybe the L4-5 is the reason. Probably is. That's the most common reason. However, the only way to know for sure why you have leg pain and buttock pain is what's called a physical exam. And if the doctor didn't press on your back and check your back, then we don't know why you have the back and leg pain. So you have two options. One, get a real diagnosis, and then the treatment you get should be the treatment for that diagnosis. That's what Deuk Spine does better than anyone. I'd recommend you use our free MRI review to do that. Second option is, let's assume your surgeon's right, it's the L4-5 and the nerve's pinched. What your surgeon's going to offer you is a laminectomy, where he's going to go in invasive, peel the muscles off the spine, remove your bones and ligaments, weaken your spine permanently, and then either do a fusion then or do a fusion a year later. Okay? But you're going to still be in pain the rest of your life if you do that, open back surgery. We're recommending the surgery you just watched come from the side and go through a natural hole that's in your spine, right there. That's what I just did. Go there. Don't go here and remove bones from here, which is what other doctors do. Come from the side and do the Deuk laser disc repair. That's your best option. Either way, you need to send your MRI to us so we can review it and do a telemedicine. We'll make a diagnosis. We'll tell you why you're having buttock and leg pain. More importantly, we'll fix it for you permanently.
And that is it for questions.
All right, I hope you enjoyed the live stream, and we'll be back in an hour. We have another patient. This next patient is actually local in Florida. He is having two bad discs, L4-5 and L3-4. We're going to be fixing both of them from the right side where he's having his leg pain. So we'll fix his back pain, we'll fix his leg pain permanently with the Deuk laser disc repair. Thanks for joining us. We'll be back.